baby. Listen carefully.
Hello, I'm Dr. Stanley Zidlow. As Director of Emergency Medical Services at Northwest Community Hospital, I've seen too many tragedies that shouldn't have happened. Adults and children who could have been saved if the people who were with them would have known how to handle the emergency. Those experiences led me to encourage the development of emergency medical training programs now in use all over the country. Nothing can replace qualified, trained medical professionals, but the procedures you'll see demonstrated are fairly simple and can be done by just about anyone. The purpose of this video is to show you what you can do in an emergency during those first critical minutes before medical help arrives. This could be the most important video you'll ever see. I urge you and every member of your family to watch it carefully. Watch it several times during the year so you won't forget the procedures. Then, if a situation calls for emergency action, you'll know what to do.
When I think about that poor baby, it just breaks my heart, especially those terrible minutes before the ambulance got there. There was nothing that mother could do except watch her little boy struggle for air because she didn't know what to do. It must have been agonizing.
How about this? Charlie Spencer, assistant marketing manager, nice house, wife, coach a Little League team one of his sons played for. A family picnic, he chokes on a piece of barbecued chicken. Dies just before the ambulance arrives. 44 years old. What a waste.
It is a waste. If his wife or children knew the Heimlich maneuver, Charlie Spencer's kids would still have a dad.
It's true. Medical help is often more than 4 to 6 minutes away. Enough time for a common emergency to become a family tragedy. The first 4 minutes after an emergency are critical.
But you can make a difference. You could save a child's life, or your husband's, or your wife's.
Or even your own. We're going to show you how. How to help someone who stops breathing or whose heart stops. Someone who's choking, who's taken poison or drugs, who's bleeding heavily, who's been burned or inhaled too much smoke, and someone who's got frostbite. The first step in all emergencies is to call for professional medical help.
In many places, that means dialing 911 or your local emergency medical service.
Use the emergency phone sticker that came with this tape to keep those numbers handy. But while help is on the way, critical minutes are passing.
We've set up a few emergency demonstrations to show you what to do.
Follow along with us and practice the techniques as we show them to you.
That's right. So you and your whole family will be prepared.
The American Lung Association says that anyone over 12 can do these techniques.
Write down a few dates on your calendar to review this tape, and then mentally practice these methods to keep them fresh in your mind.
When someone stops breathing, their heart may still beat, but their lungs aren't getting any oxygen. What you do for this is called mouth-to-mouth resuscitation. First, see if the person is unconscious.
Julie, call an ambulance, hurry! Grandpa, can you hear me?
He's unconscious. Look, listen, and feel for breathing. You should see the chest rise and hear and feel air going in and out of his mouth and nose. Never do mouth-to-mouth if the person is breathing.
Oh, God, he's not breathing.
You'll have to open his airway quickly and give him mouth-to-mouth resuscitation.
1001, 1002, 1003, 1004, 1005. 1001, 1002, 1003, 1004, 1005.
It's a very quick series of steps. Let's go over them again, slowly this time.
First, make sure he's flat on his back on a hard surface. Kneel next to him and remove anything from his mouth by using your finger to sweep it from top to bottom. Gently lift his chin and press down on his forehead to open the airway.
Sometimes an open airway is all he'll need to start breathing.
But if he doesn't start breathing, you've got to breathe for him. Keep the airway open and pinch his nostrils shut. Take a deep breath. Seal your mouth over his and blow hard. Give him 2 slow, long, full breaths, like you're blowing up a balloon. Then check his pulse. The best place to check is right here, on the side of his neck, using your first 2 fingers. Press down gently.
Right. Now's a good time to pause your VCR and find your own pulse. Then practice on someone else so you won't have a problem finding it when you need to.
If there's a pulse, that means his heart is still beating, but he may not be breathing. So keep giving him mouth to mouth about 1 breath every 5 seconds until he's breathing on his own.
1005, 1001, 1002, 1003, 1004, 1005.
Keep checking for the person's pulse every few
1001.
minutes.
Children under 8 have smaller lungs and smaller airways. Blow enough air to make the chest rise. Also, because their lungs are smaller, they breathe faster, and so you need to breathe faster for them. After the first 2 breaths, give them 1 breath every 4 seconds.
1001, 1002, 1003, 1004. 1001, 1002, 1003, 1004.
Babies under a year need special care. Their lungs are even smaller and much more delicate. First, tilt the baby's head back, but not as far as you would for an adult. It may narrow the airway. Once the airway is open, seal your mouth over its mouth and nose.
Because a baby's lungs are so small, don't take a deep breath. Merely fill your cheeks and give the baby a puff of air, like this. Be sure the baby's chest rises.
Start off by giving him 2 or 3 puffs. Then give him 1 puff every 3 seconds.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
There's no pulse. His heart has stopped.
If there's no pulse for 5 to 10 seconds, then no blood is flowing. You'll have to start CPR.
He's got 6 minutes or less before permanent brain damage. Start CPR right now. Find the lower end of his sternum, where the lowest set of ribs meet. A bone may be felt below it called the xiphoid.
It's important that you can find the xiphoid. Take time now to find your own xiphoid first. And then try to find it on someone else.
Put your ring finger on the xiphoid. Your next 2 fingers measure up the sternum to the spot where you put the heel of your other hand. Put the first hand on top of the second and interlace the fingers. Only the heel of your bottom hand should touch the person, not even your fingers. You've got to press hard enough to pump the heart, so lean into it with your weight, firm and fast. Do it 15 times. Listen to the rhythm.
10 and 11 and 12 and 13 and 14 and 15.
Then quickly give 2 mouth-to-mouth breaths. Be sure the nose is pinched, otherwise air will escape. Keep up this cycle of 15 pumps and 2 breaths until help arrives or the person starts breathing and his heart beats. Check his pulse and breathing often. As you've seen, CPR is a combination of mouth-to-mouth breathing and chest compressions or pumps. You are breathing for them and circulating their blood. Let's practice CPR for adults. Find a firm pillow and follow my lead. This practice will give you the rhythm for pumping and breathing for an adult. Start with 2 breaths and then interlace your fingers and begin compressions. And 1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, and 13, and 14, and 15. And 1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, and 13, and 14, and 15. And 1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, and 13, and 14, and 15. And 1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, and 13, and 14, and 15. Try this a few more times on your own.
CPR for children under 8 is basically the same, except you don't press as hard and the pace is faster, especially on smaller children. And you only do 5 pumps and then 1 breath.
1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5.
Now, let's practice the rhythm for children's CPR. And 1 and 2 and 3 and 4 and 5. And 1 and 2 and 3 and 4 and 5. And 1 and 2 and 3 and 4 and 5. And 1 and 2 and 3 and 4 and 5. Try this at home too. With babies, CPR is done even more gently. First, hold the baby along your arm, supporting its head and spine. Put only the tips of your first 2 fingers in the center of the chest, just below the line between the nipples. Pump the heart 5 times, and then give 1 puff of air. A baby's ribs are delicate, so you don't have to press hard, but pump faster than you would for an adult, almost 2 a second. And its lungs are small, so only a puff of air is needed.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Again, practice on your pillow along with me, this time using the rhythm for infants. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Continue to practice this until you're comfortable with the rhythm.
Once you start CPR, never give up until help arrives.
Or until his heart starts beating and he's breathing again.
CPR is not just for heart attacks. Other situations might be drowning or shock. It's used anytime a person's heart stops beating.
The key for giving basic life support is to think A, B, C. A is for airway. B is for breathing. And C is for circulation.
While the best way to learn CPR is to take a class, this tape will familiarize you with it, or if you've taken the course, serve as a refresher.
Practice your CPR at home, especially the right rhythm for pumps and breathing.
But never practice on a real person. You could cause some harm.
Use a firm pillow or sofa cushion instead.
Thousands of people choke to death every year.
And more babies die from choking than from anything else.
Most of these deaths wouldn't happen if someone nearby knew the simple and effective life-saving technique called the Heimlich maneuver. If the victim can breathe at all,
Can you cough?
if she can, then back off, but stay nearby. Let her try to clear her throat herself. But if she can't breathe at all, or if she makes a choking sign, most people grab their throats. You've only got a few minutes before her heart stops. Whether she's sitting or standing, get behind her and wrap your arms around her waist. Make a fist and put it just above her navel, with the thumb side into her stomach. With your other hand, grab your fist and pull it up and inwards into her stomach 4 times quickly. If these first 4 thrusts don't clear the airway, try again. And don't give up until her airway is clear.
She's unconscious.
See if you can remove the object with your finger. If not, put her on her back and turn her head to the side. Put the heel of one hand between her navel and ribs, right in the center of her stomach. Put your other hand on top of the first, and press upward toward the chest with 4 quick thrusts. Don't push on the ribs or xiphoid. Keep this up until the object is freed. Open her mouth, push her tongue forward, and clear out the object with your finger.
Remember the ABCs. If she stopped breathing, give her mouth to mouth. If her heart stopped, start CPR.
Children under 8 are smaller and more fragile. Use the same procedure, but don't squeeze so hard. When an infant under a year is choking, hold it face down over your forearm. Support the chin with your hand so the head is lower than the chest. Give 4 quick but gentle blows with the heel of your hand between the shoulder blades. If this doesn't work, turn the baby over and give him 4 quick but gentle chest thrusts. Don't ever try to clear a child or baby's mouth with your finger unless you see the object and you're sure you won't push it down its throat. If you're alone, you can do the Heimlich maneuver on yourself in 2 ways. One way is to give yourself stomach thrusts until the object is freed.
You can try this on yourself for practice, but be careful. Don't use full force.
The other way is to stand over a solid horizontal edge, like the back of a chair or a railing, and press your stomach into the edge quick and hard. There's 2 important points about the Heimlich maneuver: the correct position of your hands and the proper amount of force.
When you practice on an adult, don't use full force, and never practice on children or infants.
Now get that pillow and try it with me. First for an adult or child. 1, 2, 3, 4. Then for an infant, 4 gentle blows to the back. And if that doesn't work, 4 chest thrusts.
In a real situation, you may not get results the first few attempts, but don't give up. Keep on trying. What if you walk into a room and find your child took poison or drugs?
First, don't take chances. Assume he took enough to kill and call for help right away. Then see if he's conscious.
Billy, can you hear me?
Yeah.
Billy, how many of these did you take?
I don't know.
When? When did you
I
take
don't know.
these? Answer me.
I don't know.
Poison control?
Call poison control. Tell them the person's age and weight, what he took, about how much, and when. Tell them if he vomited and how long it will take to get him to a hospital or clinic. Follow their instructions carefully. Depending on what he took, they may tell you to give him milk or water, or to make him vomit. But don't do anything unless poison control tells you to. There are only 2 right ways of making someone vomit: by sticking your finger down the throat to cause a gag reflex. Be careful not to gouge or scratch the throat with this method, or by giving him syrup of Ipecac, which must be given with a glass of water.
You can buy Ipecac at your drugstore. You don't need a prescription, and you should keep some in your house, especially if you have children. The dose is 2 tablespoons for adults and 1 tablespoon for children.
Also, you must save everything the person vomits and bring it to the hospital.
If the person becomes scared, try to calm him down.
But if he's violent, leave. Emergency medical technicians are trained to handle this. Don't become a victim yourself.
Billy, can you hear me? Billy.
If the person is unconscious, don't call poison control. They can't help you. Call for emergency help and stay with him. Remember the ABCs. If he stops breathing, give him mouth to mouth. If his heart stops, start CPR.
But never force unconscious persons to drink, and never try to make them vomit.
If there is vomit, get it out of the mouth and make sure the airway stays clear.
Usually, cuts need nothing more than a bandage. But what about deep cuts, where fat shows or continual bleeding occurs? You've got to act fast.
The best way to stop bleeding is with direct, firm, and continuous pressure right on the wound. Use a sterile dressing, a clean cloth, a towel, or even your bare hand if you have to, and keep it there until help arrives. You can pressure stop almost all bleeding. Don't take off any dressings because you risk restarting the bleeding. If the bleeding continues, just put additional dressings over the first and use more pressure. When an arm or a leg is bleeding, but not broken, raise it above the level of the heart as you apply pressure. It may decrease the bleeding. If there's something in the wound, even a piece of glass, don't try to remove it. You might cause more damage and bleeding. Just put your hand around it, careful not to move it, and apply pressure to squeeze the blood vessels closed.
External bleeding is the one emergency you should take care of before you do anything else, because it can take only a few minutes to bleed to death. Once the bleeding is under control, then call for help.
Proper treatment of burns depends on whether they're first, second, or third degree burns. Here's how they look.
First-degree burns only damage the top layer of skin, which turns red and blotchy. no blisters, although they could develop later.
Quickly put the burned area under cold water to help relieve the pain and stop the burning process. Cover it with a clean bandage, but nothing else. No butter, grease, or home remedies.
A second-degree burn damages the deeper layers of skin. The skin will be red. You'll see blisters, a moist, oozy appearance on the surface, and there's a great amount of pain.
Use cold water to stop further injury and to ease the pain. Pat the area dry with a clean towel. And cover it with a dry dressing or cloth to prevent infection. But don't put anything on the burn and don't break the blisters. Raising burned arms and legs above the heart will help the pain.
Third-degree burns reach the deepest layers of skin and even bone, leaving the area white or charred. Because nerve endings are destroyed, there's little or no pain, but don't let that fool you. The damage is severe.
For third-degree burns, call for medical help right away. Don't move any clothes that are stuck to the burn. Never put ice on third-degree burns either.
Again, don't use ointments, sprays, or home remedies.
Make sure the person is breathing. If he's not, begin immediate mouth-to-mouth breathing or CPR. The burn must wait. He needs oxygen fast. Put a cold cloth or cool water on burned hands, face, or feet. Then cover the burn with a clean cloth or bandage and wait for the ambulance.
There's lots of things around the house that can give you serious chemical burns.
For any chemical burn, use water, and lots of it. Run water over the area for at least 5 minutes before doing anything else. Make sure you check your watch or clock. 5 minutes under running water is the minimum. After this, take off any clothes covering the burn and use more water. Once the burn has been thoroughly washed, cover it with a dressing and get medical help.
Serious chemical burn.
People die every day in house fires because they don't know what to do. This is especially true for children.
If clothing is on fire, wrapping in a blanket is good if there's one handy.
But blanket or no, it's most important to drop and roll. Just drop to the ground and roll over and over until the fire is smothered.
More deaths are caused by breathing smoke and superheated air than by actual fire. If you're caught in a fire, keep away from the smoke. Stay close to the floor where the air is cooler and get out fast. Don't open any doors until after you've felt them.
If they're hot, there's probably a fire on the other side, and you should find another way out.
But if you're trapped, don't try to hide from the fire by going into a closet or bathtub or under the bed. There's no way to hide from smoke or superheated air. Keep down.
Don't be afraid to break a window. Use a chair or lamp or anything to escape. Get out or yell to let someone know where to get you.
Even after you're out of the fire, there's still the after effects of smoke inhalation.
A person's lungs can swell up, blocking their breathing and even killing them up to 2 days after the fire. A doctor's examination is needed as soon as possible.
But for emergency action, loosen the person's clothing and watch his breathing. Be ready to give him mouth-to-mouth or CPR if he needs it.
One of the most tricky and dangerous conditions is frostbite.
That's because the affected part of the body may be numb and the victim won't feel any pain.
Frostbite usually affects the toes, fingers, nose, and ears. Treat it quickly.
What happens is fluid in the cells freeze into ice crystals, turning the skin grayish yellow, and it feels waxy and hard.
Handle all frostbitten parts gently.
The best treatment is warm water, just a little warmer than body temperature, but not hot. Never use heat lamps, hot water bottles, or heating pads, and never put the person close to a stove or oven.
Also, forget home remedies like rubbing snow onto frostbite or rubbing it with your hands. This just causes more damage.
The same goes for drinking alcohol. It slows down the circulation, so don't give it.
Can you feel them? Does it tingle?
Feels like it's burning.
Keep the affected part of the body in the warm water until you see a flush or pink color. A tingling or burning sensation means that circulation and sensation are returning. Once a frostbitten finger or toe has been thawed out, don't let it freeze again, even years later.
Or you may risk permanent damage or even amputation.
Every emergency is a potential tragedy.
But the right action can mean a happy ending.
The methods you've just seen demonstrated really do work. They are easy to do, and I know firsthand they save thousands of lives. After viewing this video several times, you'll feel more confident. It's a great feeling of security to know that if you are ever confronted with one of these emergency situations, you will be prepared.